Great. Hi, thank you for joining us. This is Josh Kling. I'm the CEO of Newport Medical Solutions. I am an ex-certified coder, but I do have two experts on the call. I have Nulima and Brooke. They're our coding leads, and they lead our teams. And so what we have done is narrowed down all of the 2022 CPT code changes to specialty specific. And so this session we'll be looking at the coding changes ICD-10 and CPT that affect the primary care world. So I'm going to jump in and let Nilima take over on this.
Sure. So go ahead, Josh.
We have 405 editorial changes. The number might look big, but really when we narrow it down by specialty, we don't see significant changes that negatively impact primary care services. We do see some positive changes in codes, and we will run through those right now.
So yeah, so we have some new codes that have been added to expand on the symptom cough a little more. We just had R05 in the past. Now we have all of these different codes to indicate acute, subacute, chronic, and cough with syncope and conditions like that. So those are new codes, just more specific, makes it easy to get claims paid with specific diagnoses. There's a new code that's been added for encounters specifically set up for counseling the patient on safety of immunization. This cannot be used when the physician is just giving general information on risks and side effects of vaccinations in encounters for another purpose. So it is specific to an encounter set up to explain the safety of vaccinations. And the code is Z71.85.
Great.
So new codes have been added to the chronic care management area. 99424, 425, 426, and 427. 425 and 427 are add-on codes. And these are, the first series is for one complex chronic condition expected to last at least 3 months. The first series of codes is when it's personally provided by a physician or other qualified healthcare professional. And the second series of codes is when it is done when it's directed by a physician and there's other clinical staff involved.
Great.
We have new codes for vaccine products. I think we can jump to the next slide. So all of these codes are for various different brands of vaccines. There's several placeholders, and these codes differ in dosages, and that's what we have to pay attention to when we use these codes. There's new codes that have been introduced for pneumococcal conjugate vaccine, for tick-borne encephalitis, for hepatitis B, and Ebola virus vaccines. So all of these are new codes again. And then lastly, we have all of these CPT codes, which are not new. They're existing CPT codes. They've just been added to an array of telemedicine services. And these codes have a star next to them in our CPT book to describe that they all qualify to be telemedicine services.
Brooke, real quick, I see 99211 on there, but I don't see the other E&M codes like 99212 through 215 or 201 through 205. Does that mean that they are not telehealth services?
No, like Nalima was saying, these have just been now included to be represented by telemedicine as well. So your E&M codes, the 99201 through 15 are still recognized as telemedicine too, or can be recognized as telemedicine.
Okay, great. All right, well, that's what we have for our primary care clients. We just want you to know we are here for you. These are some good changes. And if you have any further questions, please send us an email at coding@newportmed.com. That email gets sent to our entire coding team. So whether it's Nilima, Brooke, or their team, we will get a response to you. If it is a delayed response, know that we're not ignoring it or it's not sitting in an inbox. but we're likely doing our due diligence and looking for the information needed to respond accurately and appropriately. So thank you so much, and we will hopefully talk to you soon.
Thank you.
Thank you.